Rhinoplasty is one of the top 3 procedures in the U.S. for cosmetic surgery. Functional rhinoplasty treats how a person breathes. If they've had a nasal trauma in the past or fracture, that could potentially affect the way they breathe. The appearance of the nose can vary over a lifetime, and patients certainly over a lifetime can start to think about different aspects of the nose that they want to lessen or bring out, depending on what those locations might be. Now, it's important also to realize that the nose is made up of bone and cartilage and also skin. The skin is a very important component of the nose, and people have thick skin, people have very thin skin. And those two opposites vary in terms of what can be seen or done, or the limitations of rhinoplasty. Everything you see here in the video is it's condensed. The procedure itself took about 2 hours. Here we are prepping the patient before surgery. I'm getting 4% cocaine. I'm showing the local medication, which is 1% lidocaine with epinephrine. There's my nasal speculum. I've got the cocaine packs that are carefully being placed in the nose. I'm placing one nasal pledget on the patient's right side. And here I'm putting a nasal pledget on the left side. And now I'm injecting the nasal septum, the mucopericondyal flaps with 1% lidocaine with epinephrine, and trying to hydrodissect the nasal floor right now as I'm trying to use a 30 gauge needle to create space between the mucopericondyal flap and the cartilage. Here I am just dotting the nasal bony bridge. The dorsal aesthetic lines have significantly changed with a significant deviation, as you can see, with the shadow lines moving off to the left side with my finger on my right side. I'm pointing out, and here I am dotting out with a circle what the most prominent apex of that deviation, the bony deviation that has occurred on that left side of the patient's nose, or his left side. Here I am dotting out just the lateral osteotomies that we're planning, as well as internal osteotomies or through the medial approach, or medial osteotomies. And here again, this is the lateral osteotomy line that we're going to be using for external osteotomies. I use a high to low osteotomy for the lateral approach, and really just trying to understand exactly where the deviation of the bone is in relation to the scroll and how everything is attached, and where the mobile points are going to be in terms of the nasal bones. Here we are with the approach of medial osteotomies. First on the patient's right side, I use typically a guarded, curved 4 millimeter osteotome, and we're carefully making our way up the patient's right side through a intercartilaginous incision and skin envelope that's already been elevated prior to this with the osteotomies. And here we're putting on the nasal splint, first the Steri-Strips with Mastisol, after the reduction of the nasal bridge of the dorsum. Just put a little Steri-Strip on that external component where we used a 2 millimeter osteotome for the external osteotomy, and putting Steri-Strips on the nasal dorsum. Finishing placement of the Steri-Strips on both sides, I typically use a thermoplast splint that I like, as it conforms pretty well to the nasal dorsum without causing any pressure necrosis that might occur. Really important here to make sure that the nasal bone is set in the midline and exactly where we want it, and so that it can kind of last the course of treatment and not move or deviate. Thermoplast splint that my fellow's trimming, that really conforms to the nasal dorsum when we place it on the bridge of the nose. The thermoplast splint is going on. It's a really malleable, moldable piece of splint material that can shape the nose pretty well. And we just hold it there for a couple seconds as it hardens. And there you go, a functional and closed approach for rhinoplasty for nasal deviation. So in this male patient, we addressed all the functional components of breathing by correcting his nasal septum, which is made up of bone and cartilage, through inside incisions that heal with dissolving stitches. We move tissues called the turbinates off to the side to create more space inside the nose. We put a little piece of cartilage as a spreader graft to act such as a breathe right strip inside the nose. And on the outside, we ended up using techniques to reset the nasal bones, what's called medial and lateral osteotomies, through an internal approach as well as small access incision on the outside called an external osteotomy. And here we are able to reset the nose to have it be as straight as possible. So after the first week, there's a lot of swelling. Once the splints come out and once the casts come out, once the stitches come out, patients start to see what things might look like in terms of their final results, but it's way too soon at merely 1 week. So at about a month of recovery, of no heavy lifting, no exercise, taking it easy, I would say 1 to 2 months, once a lot of the swelling has come down, patients really start to get a sense for what their nose is going to look like because a lot of the swelling has now come down. But it's really only over a course of a year where all the swelling, or nearly all the swelling, really goes down and patients really see what their nose is going to look like for the long haul. Now, it's important that the patients understand that gravity always wins, and over a lifetime, all the facial soft tissues are changing. They all will tend to descend, and the nasal cartilages as well as the nasal skin also are affected by gravity as well. So these are aspects that are important to address when talking to patients when thinking about rhinoplasty. So here are the 3 most interesting rhinoplasty questions I've had in the last couple of months. Number 1, will my singing improve after rhinoplasty? I thought, well, it just might. There's more air going through the nose and the mouth and through those vocal cords. I think it probably would be able to provide more air to be able to belt out those notes. Number 2, when can I go back to lifeguarding? I had a patient who wanted to go back to being a lifeguard within 2 weeks after a rhinoplasty. I thought, well, maybe that wasn't the best idea after having a rhinoplasty with inside incisions and having to decide whether to save a life or protect her rhinoplasty incisions. So I said about a month after surgery. Number 3, will my taste change after rhinoplasty? And smell and taste are very interlinked, and I tell patients typically it's hard to tell and may or may not. In this particular case, the patient came back and he said, my taste buds are amazing. They're so vibrant, I'm able to taste things I could never taste before, which worked out really well for him because he was a restaurant critic. And so subsequently I felt really bad a little bit for all the restaurants that he had reviewed prior to his rhinoplasty. So with that concludes the Rhinoplasty ASPS vlog. Hope you enjoyed it. Keep watching, keep learning.